how to hold the liver in anatomical position. First we can see one large part of the liver, it will be directed rightwards, okay, and the smaller part leftwards. Then there is a short margin. This short margin is called the inferior border. This inferior border will be placed inferiorly. So the bigger area or larger lobe, that is towards the right, inferior border towards the inferior aspect. Okay. Now hold the liver by both of your hands, because part of it is in the right side and a little part of it is in the left side also. Okay. Now this surface, which is relatively smooth, it is called the anterior surface of liver. In the anterior surface, we find the impression of one ligament. This ligament is called falciform ligament. Okay. Now, on the right lobe of liver, I mean the anatomical right and left lobe is divided by this falciform ligament. Right to the falciform ligament is the right lobe of liver, anatomical lobe, and left to the falciform ligament is the left lobe of the liver. Okay. Now, on the right lobe, we can find one superior surface too. Okay. When the falciform ligament comes to the superior surface of the right lobe, it is divided or it is forming one ligament, that is called the superior layer of coronary ligament. The superior layer of coronary ligaments covers the whole of the anterior surface and it goes backwards. In the backwards, it covers the posterior inferior surface of liver and ultimately reflects on kidney. Kidney is positioned like here. Okay. So it is reflected on the kidney, forming one pouch that is called the hepatorenal pouch of Morrison. That is the most dependent part in supine position, mane শুয়ে থাকলে. Okay. Now the line of reflection is called the inferior layer of the coronary ligament. So if we go rightwards, then the superior layer of coronary ligament and the inferior layer of coronary ligament join together to form another ligament that is called the right triangular ligament. Okay. তাহলে falciform ligament dividing into superior layer, covering the whole liver, forming the inferior layer. Superior and inferior layer join to form the right triangular ligament. Now come to the left side. The falciform ligament is divided into one ligament here, that is called the left triangular. There is no coronary ligament on left side. It is just the left triangular ligament. Okay. Now, except the superior and anterior surface, the whole of the irregular surface is called the posterior inferior surface. Okay. In the posterior inferior surface, we find four lobes anatomically. The left lobe is the small part. This is the left lobe. The right lobe, the bigger one. Between the right and left lobe, there are two other lobes. The upper one is called the caudate lobe. The lower one, this is called the quadrate lobe. Okay. Now between the right lobe and the caudate lobe, there is a groove that is called groove for inferior vena cava, and the inferior vena cava is present in this groove. Now just beside the quadrate lobe, there is one fossa that is called the gallbladder fossa. In the gallbladder fossa, we find the gallbladder. Okay. Between the inferior vena cava and the gallbladder, in the gallbladder fossa, we find one area that is called the porta hepatis. In the porta hepatis, first we find one big lumen structure. The structure with the bigger lumen is the portal vein. দেখতে পাচ্ছিস সবচেয়ে বড় যে lumen, the biggest lumen is for the portal vein. Now, just beside the portal vein, there is a small lumen structure and the lumen is quite muscular. It is the hepatic artery. And except these two, there is a small lumen structure, this one. this is the hepatic, this is the bile duct. So portal vein, hepatic artery, bile duct. Clear? Okay. Now what are the impressions? Now if we hold the liver anatomically, okay, this is the anatomical position of liver. Here we find the esophagus, okay, then the stomach comes like this, okay, then the duodenum starts here, crosses the quadrate lobe as well as the gallbladder, okay. The right kidney with suprarenal gland is positioned here, and in the lower part the ascending colon is transformed into the transverse colon, and this part is called the right colic flexor. So we find the right colic flexor in the lower part of the right lobe. You people see here, this is the whole posterior inferior surface. Here we find the esophagus. Remember like this, here we find the esophagus. Now esophagus is turned into stomach. So the stomach is present in the back of the left lobe of liver. Then stomach ends into duodenum. The duodenum crosses the quadrate lobe and the gallbladder. Okay. Here we find the right kidney with right suprarenal gland. The inferior layer of coronary ligament is reflected on this right kidney with the right suprarenal. Okay. And the ascending colon, it now becoming the transverse colon. And the junction of this ascending colon and transverse colon is called the right colic flexor. And we find the right colic flexor just below the kidney with the suprarenal gland. These are all the visceral relations. Now if we look at the caudate process, caudate lobe, we find another process coming out of the caudate process and it runs rightwards. It is called the caudate process. And the left one, it is called the papillary process. The left one is called the papillary process. Okay. Now, just by the side of the papillary process, there is one small elevation. This small elevation is called tuber omental. Okay, tuber omental. Because you will study tomorrow, the pancreas has one part, one projection, that is called tuber omental 2. These two parts actually come in contact, separated by the lesser sac. Okay, the lesser sac is present like this. Just after the lesser sac, there is the pancreas, and pancreas has one tuberosity, that is called tuber omental. So the tuber omental of the liver and the tuber omental of pancreas, they come in contact, separated by lesser sac. Not in direct contact, it is also separated by the lesser sac. Clear? আচ্ছা আর কিছু